supplement plans are great, but they can be expensive. So a great way to save money is to just hold off on enrolling in a Medicare supplement plan until you're older with maybe some more extensive health needs, right? Wrong. In most states, you can actually only enroll in a Medicare supplement plan, aka Medigap plan, without medical underwriting in the 6-month window after you turn 65 and enroll in Medicare Part B. Should you choose to enroll outside of the 6-month window, then you may be subject to medical underwriting, which means you could be charged more or denied outright. And this doesn't just apply to that initial enrollment. If you wanted to change Medigap plans for any reason down the line after that initial 6-month window, then again, you would likely be subject to medical underwriting. So it's not like you can just enroll in a less expensive, lower coverage plan right now and then choose to switch to a higher coverage, perhaps more expensive plan later because medical underwriting. And even if you enroll in a specific Medigap plan right now and you're thrilled with the benefits, but all of a sudden your premiums drastically increase, then you can't just easily switch from carrier to carrier without medical underwriting. There are some states with more lenient enrollment policies, and there are new states that are looking to jump on the bandwagon. So that's what we're going to talk about in today's video. But before we do, please remember that at iHealthBrokers, we are licensed health insurance brokers. So if you have any questions whatsoever about Medigap, Medicare, health insurance in general, you can reach us in the comments below or at the number on the screen. We're licensed nationwide. We're going to be talking about a variety of different states today, so no matter where you live in the United States, we can help. And of course, there is no charge for our services. Now, things change with Medicare on a yearly basis, sometimes more frequently than once a year. So please make sure to subscribe to this channel, and of course, make sure to like this video so that way we can get this information out there. All right, let's get back to it. So as I said, there are some states that offer more lenient enrollment policies. And actually, there are a few states that offer an open enrollment with no medical underwriting every year. So far, these 3 states are Connecticut, Massachusetts, and California. Whoops, folks, I meant New York, not California. We will talk about California later in the video. We just like to keep you on your toes. So removing medical underwriting definitely makes the decision-making process much less stressful, because if you miss that initial 6-month window, it's not like you're trapped and you can't enroll at a later date. But there is a downside, and that is that in these states, Medigap premiums tend to be more expensive. So when you enroll in a Medigap plan, or really any type of health insurance plan, basically you are paying your carrier to take on your medical risk. By concentrating on a younger and perhaps healthier pool, i.e. those that have just turned 65, Medigap plans are minimizing their risk and therefore able to offer maybe lower monthly premiums. However, when you remove that safety net, they're looking to protect their bottom line, therefore higher monthly premiums. I'm not saying this is right or wrong or good or bad, it's just the way it is. So let us know your thoughts in the comments below. But there are definitely several states that think it's a very good thing. And that's why there are several states that are looking to jump on this bandwagon and have more of an open enrollment approach to Medigap plans. First and foremost, there's Minnesota, and this is actually set to come to fruition in 2026. And a fun fact about Minnesota, when we talk about Medigap plans, we talk about that the benefits and the plans are standardized, but that's not the case in Minnesota. So the plans that you're looking at there are not necessarily the same as in the rest of the country. Now, although, as I said, this is set to come to fruition in 2026, the rest of the states that we're about to discuss are still up in the air. For example, California. Now, California already has the birthday rule, which we're going to talk about later in this video, but it's actually proposed that they get rid of the birthday rule in favor of this open enrollment every year from January to March. Again, there would be no medical underwriting during this time. Washington State is also looking to jump on board, and Washington State, like California, is already one of the more lenient states. It actually has a policy in place that allows you to switch plans and carriers throughout the year without a specified time. But they would like to expand their flexibility for that initial enrollment period to offer that annual open enrollment period as well. And for other states looking to expand towards open enrollment, you can add New Jersey and New Hampshire as well. Then there is the birthday rule. Some states have already adopted this practice, with several more looking to jump on board. So currently, the several states that have already adopted the birthday rule are California, although they may be looking to make the switch, Idaho, Illinois, Nevada, Louisiana, Oregon, and now Oklahoma and Kentucky as well. The birthday rule may vary slightly from state to state, but basically it states that every year, for a certain window of time surrounding your birthday, you are able to switch plans. It can either be from carrier to carrier or really just to downgrade. So you can see already why there is a problem there. Now, if you've selected a more comprehensive coverage plan and you're just looking to switch carriers because maybe your premium has gone up more dramatically than another carrier, then no issue. But if you're someone who is looking for more coverage, maybe you've selected a plan with lower coverage, something like a cost-sharing plan, Plan K or Plan L, and now you find yourself in need of a more comprehensive coverage plan like Plan G or Plan N, then this isn't really going to help you. In most states, that window of time is about 60 days. It can vary slightly. For example, in Illinois, it's 45 days. And there are some other issues with Illinois and the birthday rule as well. Number one, this is only applicable to those between 65 and 75. So again, you can see some issues. And you can only switch to a plan with the exact same insurance carrier that you currently have. Obviously, this is extremely prohibitive, but as of 2026, the second portion of that, the fact that you can only switch to a plan offered by your exact same carrier, is going to change as well. You should be able to change to a plan offered by any carrier. However, the 65 to 75 age barrier remains. Also, Nebraska, Georgia, Michigan, Rhode Island, South Carolina, Virginia, Utah, Ohio, and Texas have all proposed some type of change in legislation to adopt some type of birthday rule instead, although as of the recording of this video, none of those legislations have been approved. Now, as I mentioned earlier, very often there can be an issue with the birthday rule, which is that usually it only either allows you to keep the same plan and switch carriers or downgrade to a less comprehensive coverage type of plan. However, a new piece of legislation proposed by New Mexico would allow enrollees to possibly upgrade during that birthday window. But again, this is just a proposed piece of legislation. It has yet to be approved. There are two other outliers that I want to discuss. Now, these are already in effect. The first of which is Maine, which, like the birthday rule, you can switch to a plan that is the same plan, different carrier, or downgrade, but you can actually do that at any time during the year. And then in Missouri, there's sort of this anniversary rule, which surrounding your Medigap anniversary, you can keep the same plan, but switch to a different carrier without medical underwriting. Now, despite these changes and proposed changes, it's really in your best interest in most states to pick a plan that most closely aligns with your long-term needs in that initial 6-month window. There are 10 basic plans to choose from. Plan F and Plan G also have a high deductible version, which we will talk about as well. Now, not all of these plans are available to new enrollees. Namely, Plan C and Plan F are no longer being offered to new enrollees. And of course, these plans have varying price points and varying levels of coverage, which you can see. So a check mark, of course, indicates that this benefit here on the left is offered by this plan. You will see sometimes it's asterisked, or in the cases of Plan K and Plan L, which are cost-sharing plans, Plan K will cover 50% of the copay or coinsurance associated with that benefit. Plan L will cover 75% of the copay or coinsurance associated with that benefit. So let's start. Part A, coinsurance and hospital costs up to an additional 365 days after Medicare benefits are used up. Now, as we've seen when we looked at the Part A hospital costs for inpatient care past 60 days, you can see that all of the plans will cover that, and that can be a significant cost. Part B, coinsurance or copays, that would be that 20% that we looked at. Then all of the plans are going to cover that to some extent. Again, Plan K and Plan L only covering a portion of that coinsurance or copay. You will see here that this is asterisked. And that is because Plan N pays for 100% of the Part B services, except for copays for some office visits and some emergency room visits. So sometimes you may have an additional copay not covered by Plan N. It's not really going to be a make it or break it factor when deciding between Plan N and Plan G, which we will talk about later in the video, but it is something you should be aware of. Blood for transfusion, covered by all plans. Part A, hospice care, coinsurance or copays. Skilled nursing facility care, and as we talked about, if you stay more than 3 weeks, those costs can be rather significant. All plans except for A and B will cover that. Part A deductible, that one is huge. All plans except for Plan A cover that. There's a reason Plan A is definitely not one of our favorites. And very often you will see that it's not like the monthly premium is so much less. So there's usually not really a reason to go for Plan A. Now the rest of the plans will cover it to some extent. Plan M will only cover 50%, and Plan K and Plan L still those cost sharing plans. The Part B deductible, that is a smaller figure. It is applied once annually, and no plans being offered to new enrollees will cover that. So the only plans that ever did cover it were C and F, and those are slowly being phased out. Part B, excess charges. So these are basically excess charges that can be charged by certain
doctors. When your doctor agrees to contract with Medicare, they agree to accept the amount that Medicare will approve. However, doctors can choose to charge up to 15% more than that. And that's what's known as a Part B excess charge. Now, none of the plans will cover that except for Plan G and Plan F. Again, Plan F not offered to new enrollees. So if this is something that's very important to you, then you want to go for Plan G. That being said, Part B excess charges are not that common, and they're not even legal in all states. So again, this is not a deciding factor. For a travel emergency, all plans will cover that in some capacity except for A, B, K, and L. And then there's an out-of-pocket limit. So the cost-sharing plans will impose an out-of-pocket maximum. For Plan K in 2025, it's $7,220. And for Plan L in 2025, it's $3,610. That's because these plans are only covering a portion of the benefits, so you do need to impose some type of out-of-pocket maximum to ensure that your medical spending is capped in some capacity. The rest of them do not offer an out-of-pocket maximum, and of course, Original Medicare does not have an out-of-pocket maximum. But for a vast majority of these plans, most of your out-of-pocket costs are going to be taken care of by the Medicare supplement plan itself.
So how do you feel about these potential upcoming changes and these solidified upcoming changes? Let us know in the comments below. And of course, if we missed any, make sure to let us know there as well. As always, if you have questions, you can reach us at the number on the screen or in the comments. Like I said, we're licensed health insurance brokers. And if you'd like to learn more about Medigap versus Medicare Advantage, make sure to check out this video over here, or you can learn more about Medicare in general with our Medicare playlist. Please make sure to like and subscribe before you go, and we'll see you next time.